Well, good afternoon. Thank you for joining us today for a special session. Today is February 18th, 2022, and if you've been reading any of the emails I've sent, looked at any of the news stories, or seen any of the updates from Boulder County Public Health, you'll know that at 5 p.m. today, there's kind of a big transition happening in our community. So my name is Corinne Walda. I'm the Senior Director of Economic Vitality at the Boulder Chamber. I'm pleased to be joined today by Boulder County Public Health to kind of answer those last minute questions you might have about the mask mandate going away. It goes away today at 5 p.m. and we're going to go through all the details. We're still going to talk a little bit about the data because a lot of you have emailed in asking, what's the current data? Where should we be when you're trying to make the decisions you want to make on your individual mask policies or your vaccine policies? So I think Tessa today put together, saw some of these questions coming in and put together a presentation to try to cover a lot, but if not all, please feel free to put your questions in the Q&A. At this time, I'm going to hand it over to Tessa and have her get started. And then again, we'll do Q&A after she's done.
Thanks, Corinne. I'm Tessa Hale with Boulder County Public Health. And before we get started, I just want to give a big shout out to Corinne and thank her for being so supportive of public health and the business community through all of this. I know that in September, when this mask mandate went in place, it was really hard on a lot of businesses, and there have been a lot of questions. And I just want to appreciate that Corinne has been really responsive, and thank you so much for continuing to help us to communicate our message and to answer questions that the business community has. So thank you. So as Corinne said, we'll get started with the latest data. This data is from February 15th. So the main things to know, we are still in what the CDC considers high transmission. Our hospitalizations are decreasing, but the system is still experiencing stress as there's staffing shortages and a backlog of procedures and surgeries scheduled. The death rate continues to rise. Our testing positivity has decreased this week. We're doing really well on vaccinations. Over 92% of Boulder County residents have had at least one dose of a vaccine, which is really significant. That's not just for eligible, that's for the entire county as a whole. As we go through the data, please note that there are still data gaps as we continue to try and catch up from the extreme rates of transmission that we were trying to keep up with. So as you can see here, we have decreased, whoops, sorry about that. Our case rates have decreased significantly. We're down to 273 cases on our rolling 7-day average. The transmission rates across the entire state also continue to go down. And just as a reminder of what these transmission rates are based on, it's the CDC tracker, and the masking order that was put in place, which was during the Delta variant, was that we were looking to get to 50 per 100,000 people or below. We are not there, and I'll talk a little bit more about that. But when we talk about our transmission rates and our recommendations for how we move forward with the mask mandate ending, we are still in what's considered that high transmission rate. The case trends among all age groups are dropping. The highest case rates currently are between 35 to 44-year-olds, but across the board, everyone, the case rates are dropping. Testing rates are also dropping. You'll see we're now at a 10% positivity rate for testing. When we look at the healthcare system, we are continuing to see declines on the stress in the healthcare system. The number of confirmed COVID-19 patients decreased by 30% in the week ending last week. 52% of hospitals are still experiencing tight staffing, which is a reduction from 59% last week. The ICU bed availability went up to 10%, which is a percent up from the previous week. And our medical and surgical bed availability is remaining at 7%. And according to CDPHE, 11% of available hospital beds are occupied by confirmed and suspected COVID-19 patients, which is down from 20% last week. And then our 7-day average for pediatric cases, there's 30 confirmed pediatric cases, which is a 3% decrease from last week. In terms of hospitalizations in Boulder County, there are 30 people currently hospitalized with confirmed COVID-19, and there are 12 staffed ICU beds available. In regard to healthcare system responses, our hospital operations are shifting to a more normal response. With regard to staffing support, as you may recall, we were under special orders and had support in the state from the National Guard and supplemental medical staff. All of these things are ending, and by April 1st, hospitals we anticipate will be back to normal operations. There still continues to be a stress on healthcare systems, and really it's about delayed and non-COVID medical needs, people just getting caught up on procedures and surgeries that had to be delayed due to high rates of COVID hospitalizations. And then the combined hospital transfer center plan is lowered to tier 1, which essentially means that people will be able to stay at their home hospitals if they are in need of a hospital. And finally, flu hospitalizations remain low compared to previous COVID seasons. With regard to deaths, we have had 108 deaths since May of 2021 and 365 deaths total since the beginning. We know that there's a lag between case rates dropping and hospitalizations and deaths, so we do anticipate that there will be some more deaths, but that will also decline. As I noted earlier, we have 92% of our total population has had at least one dose of the vaccine. 70% of our total population has had a full course of the vaccine. We're really pleased to see that we are at such a high rate of protection through vaccination status. And statewide, CDPHE reports that we're at an 80% immunity rate. In terms of being up to date on COVID vaccines, what up to date means by the CDC is that people who are eligible for a booster have received their booster. Each week we've continued to see an uptake in people getting their booster shots, and so we're pleased to see the continued uptake in vaccinations. And Boulder County Public Health is still offering free vaccine clinics at the Boulder County Fairgrounds. Really easy to do. You can just drive up, stay in your car, you get a vaccine, it's free, no ID or documentation required. I will get these slides to Corinne and you can just scan, or you can go online to our website. You can make an appointment online. It's really easy to do. So as Corinne noted, our order is ending, and we're going to talk more about that, but this is just a little bit for your situational awareness around what's happened in neighboring communities. As you can see that pretty much all of the surrounding counties have already, or immediately surrounding counties have already ended their order, and Pitkin County will end their masking order on February 22nd. The school orders are sometimes have ended at the same time, sometimes are a little bit delayed. And for Boulder County Public Health, the Board of Health voted for both our school order and for our universal indoor masking order to end on the same date, which is today. And with regard to what this means, there are still state and federal regulations in place with masking. And so I just want to clarify what that looks like. So for the state requirement, people who are unvaccinated and 11 or older in jails, prisons, community correction centers, homeless shelters, emergency medical and other healthcare services, which could be clinics, emergency rooms, urgent care centers, and public transportation, are all still required to be wearing masks. That's for unvaccinated individuals 11 and older in those settings. That particular order expires every 30 days. It's been renewed 12 times. It is set to expire again on March 1st, and we don't know what the state will decide to do on March 1st. But we will continue to update the community about that. Long-term care facilities are highly regulated by the state, and that order is not set to expire at any point. Federal regulations that are still in place are masking required and Head Start programs for children 2 and up. School buses are requiring masking for children 2 and up, and public conveyances, ride shares, Lyft, Ubers, public buses, all requiring masking for individuals 2 and up. There is no expiration date set for those. With regard to traveling, the Transportation Security Administration has a mask requirement on airplanes and in airports for all people 2 and up. That is currently set to expire on March 18th. We don't have any information about whether that will be extended or not. So with the mask order ending, the mask order is ending today at 5 p.m. And we want to communicate out that public health recognizes there are people on both sides of the continuum of how they feel about this mandate ending. And there was a lot of thought that went into it. I know that Corinne has shared the recording from the Board of Health where Dr. Lexi Nolan, our deputy director, really went into a thorough explanation of all of the different factors that went into making the decision to end the mandate. We also want to provide recommendations, and there's an advisory going out today that will cover these recommendations so you can see them in detail, but I wanted to share them here. We are still in high transmission. Omicron is also very different than Delta, which is the variant that was spreading at the time we put the masking order in place. So we know that Omicron is more infectious, much less severe, and with the downward trajectory of cases, we feel like what we're moving into is a new era when we're going to live with COVID in some form, and this is an infectious disease that we are just going to have to use safe practices, and it will be a part of our everyday lives. So first and foremost, our recommendation is for people to be vaccinated. So if you have not yet been vaccinated and you're eligible, we highly recommend it. And secondly, to stay up to date on vaccinations, which is that if you are 5 months out from a Pfizer or Moderna, you're eligible for a booster, or 2 months out from Johnson & Johnson. We are also continuing to recommend face coverings. For individuals who are up to date on their vaccination, we are highly recommending to wear a strong medical grade mask while you're in close proximity to someone who's at high risk for disease. For individuals who are not up to date on vaccination, we can really highly recommend to continue to wear a medical grade, there's an E missing on that, covering while Boulder County remains in substantial high transmission, which is where we are right now. And also, like even people who are up to date on their vaccinations, to wear those masks while in close proximity to individuals who are at high risk. And for individuals who are at high risk for severe disease, hospitalization, and death, we really encourage these individuals to continue wearing snugly fit medical grade face coverings to protect themselves from COVID-19. With regard to testing, we recommend if you are feeling sick to test. Also, if you plan to be in close proximity with someone who is at high risk, to go ahead and get tested before you spend time with that individual. These other mitigation strategies, I know you're all familiar with, we've talked about them a lot of times. Increased, Corinne's smiling, it's the 5-star program. Increased airflow and ventilation, wash your hands, stay home when you're sick, and stay away from others when they are sick. And consult with your healthcare provider on a recommended course of action, including any therapies that might be available to you if you're exposed to someone with COVID-19, you come down with symptoms, or you test positive. These are the recommendations we have, probably very relevant to this audience, that are for businesses and facilities. As I discussed earlier, some businesses and facilities are subject to state or federal requirements. They should continue to follow those. Some businesses and facilities may choose to implement additional mitigation measures as a matter of their own decision-making internal policy process. So in light of this ending, we've already heard of some businesses that are going to continue to require masking in their establishment, or to require masking at certain times so that vulnerable populations would feel more comfortable coming in. People could continue to offer face coverings to people coming in. If possible, you can move activities outdoors, again, increasing ventilation to the extent possible, or implementing vaccination requirements if people don't already have those in place. This order sunsetting also impacts our vaccine verification program. So that VVP program deactivates today at 5 p.m. at the same time as the masking order ending. We are sending out a survey today for participants of that program to find out if some facilities are going to continue with the program and if they would like to remain up on our website. We will have a page listing businesses who are have a vaccine verification policy in place. So it's up to individual facilities to decide if they want to maintain their current policy. There may be some individual facilities that decide they want to implement a policy, and or to create a policy, again, that's flexible, that would have vaccine verified hours so that at-risk individuals, children 5 and under, older people, and immunocompromised individuals could feel safe in their facility. With these changes, there's been some questions about what happens, what are business obligations with regard to reporting COVID cases. It's no longer required for businesses to report positive COVID cases. We do strongly encourage reporting so that we can provide guidance and help also track if there's clusters of cases or outbreaks. The email address here, I will also share this with Corinne, is COVID-19 EpiLine. That's where any questions you have, or you have a positive case you need to report or have questions about, please contact public health through that email. And if there is a case reported in your business, to the extent that you know who was exposed in your business, please notify those individuals that were exposed. And exposed individuals should follow the quarantine guidance based on their vaccination status, which I have here. These are the isolation and quarantine guidelines. And I feel like we've seen this a lot, and I'm just going to move through this so we can get to some questions. But again, these slides will be available to you. There is still this free mask initiative happening, so please feel free to reach out for some free masks. And then this is our list of all of the COVID-19 data available.
So thanks, Tessa. Don't take down your slides. Oh, you just took them down. That's okay. We can go back. So if we're going to go to the question that's come in a couple times, which is, if I have a positive case in my business, do I report it? And you got the answer there, which was, you don't need, you can, but you don't need to report, but you should monitor for clusters of cases or potential outbreaks within your business and then report through the EpiLine. Now, is this among customers, employees? So if a customer calls you and says, I have a COVID case, I'm COVID positive, does a business need to report that customer, or is that customer already reported through their individual testing status?
That individual is reported through their testing status. However, I would say that if you are, say, a fitness facility and you know that this person took a class with a group of 20 individuals, then you would want to probably inform those individuals that they were exposed.
So if they were within 6 feet of the person for more than 15 minutes, mask or no mask, that you need to inform that they might have been exposed and to follow the quarantine and isolation guidelines as indicated by your vaccine.
That is our recommendation.
Okay. So, but really businesses should be monitoring really about, those clusters of cases, those potential outbreaks, and that, they want to get consultation from the EpiLine if they have groups of, if they have several people, several employees and a couple customers that come to them and say, I'm positive, then that might lead to a bigger investigation by Epi. epidemiology.
Yes, and I would say maybe not so much an investigation. Our contact investigation and tracing is winding down at this time, but our epi line is there to be able to provide guidance. And as we know that the CDC and other guidelines are going to continue changing, it would be the best way to stay up to date on what the next steps are to take.
Great. I just fed you that. So I'm glad you were able to talk about it's not really an investigation, it's more help. It used to be an investigation, so I think a lot of businesses are still in that mindset. To clarify, would the exposure have to be 2 days? Is it exposure within 2 days of symptoms? When symptoms start, 2 days within testing? What's the time frame in which you need to notify people?
Thank you for checking in on that, Corinne. That is remaining the same, 2 days from onset of symptoms or a positive test. 48 hours back from that onset of symptoms or positive test would be considered an exposure.
Thank you. So it's still the 2 days, and then the quarantine, we've seen the quarantine and isolation. And again, I always promote this. There's a chart that I send out, and I literally have it up here, and it has all of this stuff in a chart format. If you're vaccinated, if you're not vaccinated, and what you need to do. All right, let's talk a little bit about, go back to the state requirements if you can. Let's talk a little bit about the state right there. All right. So masks are required for unvaccinated individuals 11 plus in these areas. There is a question about what emergency medical and other healthcare services include, whether that includes physicians' offices, private practices, lactation consultation, if it's covered by insurance. One thing I'm going to put into the chat is the state site does list, they go into longer detail of what this includes. So it includes hospitals, ambulatory surgical centers, urgent care centers, long-term care facilities, clinics, doctors' offices, and non-urgent medical structures. So yes. Does this mean a physician's office or a private practice needs to require masks for those that are unvaccinated, 11 and above?
Yes, it does mean that. And what we are seeing here in Boulder County is that we anticipate that most healthcare providers will include a universal masking mandate during this time of high transmission. But at a minimum, it is a state requirement for unvaccinated individuals to be wearing a mask 11 and up in all those healthcare settings that you listed.
And this is the order that you're not sure if it's going to be continued. It's renewed every month, and it's been renewed for the last 12 months, and it's up for renewal at the beginning of March.
Correct.
Okay. Now, does this include chiropractic and massage clinics? I think we need to separate those two, because one's personal services, and it could be limited healthcare if it's directed by a doctor, as we learned through the orders, and then chiropractors.
Chiropractors would be considered under that healthcare services. Massage therapy is not included in that unless, as you clarified, it is through part of a healthcare setting.
Somebody said that they missed earlier on the presentation. They asked, what did the metrics change to instead of 50 per 100,000 cases over 7 days in order to list the mask mandate? They didn't change the metrics of the mask mandate, correct? They just lifted the mask mandate with the dialogue, and I did put the link to the Board of Health meeting where Lexi talked about this. Dialogue being that currently COVID is different than what it was when you put the mask mandate in place, and that the dialogue is shifting about how we talk about COVID as far as being part of being in our lives and long term and mitigating risks for high risk individuals. So there was no change in metrics, right?
There was no change in metrics, which is why the order was rescinded, because we didn't hit that metric, but instead, based on this changing landscape where essentially the Omicron variant is similar to other infectious diseases that we live with on a regular basis, that it's time for us to shift into learning to live with this rather than imposing more stringent mitigation strategies that are challenging in other ways for people to live with.
But if a business would like to continue, if they want, while we're in high transmission, according to the CDC, because as you pointed out, we're still in high transmission, if they'd like to continue requiring masks, requiring vaccinations, that is up to the business to do if they don't fall under some of the other state and federal requirements, correct?
Yes, that is, and we are supportive of that. And the advisory that will be going out today, that Corinne, I'll be sure to share with you, to share with businesses, really stresses that end part of the presentation that talks about encouraging and supporting businesses to continue to have a mask mandate, other mitigation strategies, including vaccine policies. We are still supporting and recommending those as best strategies.
Well, and even if you're not requiring it for your business, just to being supportive of those individuals that choose to continue to wear them. I think that was heard loud and clear on the Board of Health meeting. And just a warning on anybody that didn't listen to the Board of Health meeting, it is 4 hours long. So it's just that piece. So a lot of the presentations at the beginning. So if you see the 4 hours and you want to listen to it, the presentation part's at the beginning before the public comment. But just we heard loud and clear on that Board of Health meeting that, you know, we as a community will still support those people that choose to or need to wear masks in businesses, even if it's not required.
Yes, and we have updated signage also that is says masks are required for this facility, that it's no longer has information tied to the public health order. So if people didn't want to create their own new signage, but wants to use public health developed signage that looks similar to what has been in effect, you know, please do go ahead and download that from our website.
Well, and also I did send that out, but also the toolkit that we have in place for the mask. We have English and Spanish versions of almost every sign you need. Over the course of, I think, 24 months, we've developed over 60 signs in English and Spanish for you. And there are a couple that say, you know, that look different, that if you don't want to look like mask required or the typical public health sign, but you want something different, we have highly recommended, required for unvaccinated. We have one for please don't come in if you're sick. I think there's a bunch. So I'll put in the chat the link to that toolkit, and we are putting in the public health ones as well, so that you have one place you can go and kind of search for a different sign that might fit your needs. The highly recommended one does say according to public health guidance, so you can continue to do that. All right, so I'm going to put that in there. So here's a question. Sorry if you've already covered this, but is Boulder County fully vaccinated facility program continued, or is that no longer active since masks are no longer required? Could you go through one more time where you're going with that program, and if you're a VVP, what's the next step? Or if you'd like to continue, if you'd like to be a vaccine verified facility, what that step means? Is it a formal program or what they can do?
Sure, thank you. So the vaccine verification program deactivates at the same time as the masking order deactivates today at 5 p.m., which means that public health is no longer reviewing applications, approving facilities, or monitoring compliance. At the same time, we encourage and welcome facilities who have this policy in place to maintain it. We welcome and encourage facilities who don't have this in place to go ahead and put one in place. Corinne has very graciously offered to have some model policies for different kinds of facilities that she can share for any facilities that are interested in implementing a new one. We hope to have those to Corinne by the end of next week. For the facilities, today we're sending out a message to all of our vaccine verified 326 participating facilities with a survey to ask, are you planning to keep your vaccine verification policy in place? And do you want to be listed on our website? We will still, on our vaccine verification page, have a list of all of those facilities that do have a vaccine policy in place, so that members of the public who want to know where these policies are happening, we will still list that on our website.
Great, thank you. So if they're part of the program, don't need to continue tracking vaccine status for new employees as they come in, unless they would like to continue to do so, and it's up to them now.
Right, and it was always a voluntary program. The difference now is just that we're not monitoring what a policy looks like or the specific details or compliance.
Well, and the reason for that is because you gave an incentive by saying, yes, you are part of this program, you can remove masks. Now there doesn't need to be a transactional intermediary on that. You as a business can require vaccines at certain time, continue with that vaccine required yoga class, or this particular time of day, to make sure that that you're covering your full population, but it's not going to be monitored by the county because you're not giving them sort of this, you can remove masks now piece. And
Yep.
then someone asked, so this just came in for the VVP program, do all employees have to be boosted? Again, that's part of the company policy now, right?
Yep, it is entirely up to each individual organization to determine what their vaccine policy looks like.
And someone said if they're part of the program now but would like to no longer continue, do they need to notify public health? And that's part of the survey that you're sending out, correct? Where you're going to
Correct. Yep. So we ask if people are keeping it, and if we don't hear back from someone, we will just assume that they're not keeping their policy in place, and we won't list them on our website.
Okay. And you've actually had a couple of people come to you and say, I'd like to do this now because of the mask order going away. And again, that's where I've offered to assist with maybe providing some sample policies or giving some of the details that people have used in the past, if a business would like to now implement. But again, they're not going through a formal application process. Okay, so do you have any advice about if businesses should continue doing temperature checks and verbal screening of students, adult and youth, or when we should sunset temperature checks or verbal screenings? There's no requirement in place to do this.
There's no requirement, and it really is based on the individual facility's comfort level and the comfort level of their clients. And so we don't have any recommendations or guidance around that specifically. And so I would just say at this point, we're really back to where we were in August of 2021, where it's up to an individual business to make those decisions.
Okay, let's see what else is coming in. Out of curiosity, is there any data that shows that the VVP helped with mitigating spread? Just no judgment, just one way or another. What
Great
kind of
question.
data did you have around it?
We have, of the 326 facilities, we had one event, a one-time event that had 3 positive cases, and then one business that had a handful of positive cases. So we like to think that given that there weren't outbreaks in these facilities, that it was indeed an effective strategy for being unmasked safely.
Thank you for sharing that experience. And I did have a couple of the facilities, they're struggling with the decision of whether they should keep it because it was a lifesaver for their business, or they did see an uptick in participation because of those people that were still nervous about mask, about the safety of the certain situations. But it wasn't right for every business. And we acknowledged that with all the feedback we got back from the survey questions.
Right. I will say, one thing in thinking about it is looking at the vaccination rates in Boulder County right now. I mean, they've just continued to go up, which I think is great. Obviously, it's very different, like you said, Corinne, the incentive isn't there because there is no mask mandate. But with regard to the number of people who would be eligible to come into a facility, that number just keeps increasing as our vaccine uptake increases.
So I'm going to bring up, so we've had a couple facilities share with us their policies that they put in place as of 5 p.m. today. And we've seen across the gamut. We've seen lifting masks, period. We're going to require it for unvaccinated. We're lifting masks except for during this time, where we're going to require masks for everybody in order to meet the needs of our immunocompromised or our youth population that comes in. I think a lot of facilities are looking at who comes into their facility and do they have 0 to 4? Do they have high risk? And making some of those policy decisions. And we've seen you've seen them, I've seen them, I've shared them with you, a full line of different policies being put in place. Let's see what else is coming in. So just to let everybody know, I put in the toolkit to signage, and then I put the new public health sign. They have one that says Boulder County Public Health recommends everyone wear a mask during periods of substantial or high transmission. It looks very similar. My one criticism, it looks very similar to the mask required one. So people might see it and go, oh, wait, masks are required here, and not read the text. We do have some additional signage that, masks required for unvaccinated, stay home if you're sick, masks highly recommended in that toolkit that I put in there. And they're in English and Spanish. Usually if you click on it, there's 2 copies and it has both. Any other questions? So I think at this point, quarantine and isolation is still in effect. People still need to, just like if anybody comes in sick, they need to worry about the quarantine and isolation if they have a sick employee or someone that tests positive. And other than the state and federal orders, there's really no other orders in place that are limiting what businesses can do, correct?
Correct. And I realized I somehow skipped this slide, which is just outlining what happens at 5 p.m. today, that our school and universal indoor mask order ends. Businesses can choose to implement their own policies. Those requirements from the state and federal requirements are still in place. So, and then the public health advisory I referred to is being issued today. I don't know how I missed this slide when I was breezing through these, but here is, things as of 5 p.m. today, a few hours away.
It's a good way to kind of end. I mean, you did it on purpose. Let's just put it that way. You did
it
because this is a good summary. Somebody was late. Can you just really quickly go through the data slides one more time, just for anybody, because we did have quite a few people join us. Where are we on case count, vaccinations, and the positivity rate? So, there you go. One more. There you go.
Here we are. We're at 273 cases per 100,000, which is down from last week. The transmission rates in Colorado, downward trend all across the state. This is what we are calling the CDC has defined as different rates of transmission. We are still in high transmission rate because we're above that 100 cases per 100,000 threshold.
And we're above the 10% positivity rate too. So that's the other one. I get a lot of questions about the positivity rate. What should it be? Because that means 1 in 10 people have it, or, in their minds.
Right.
Where should it be? And what you're saying on this is, if we're looking at the original CDC standard, we need to be below 50 and we need to be below 8 on both of those. If you would like to continue to follow this CDC metric.
Right. Thank you. The case rates are trending down among all age groups.
And then if you want to just jump to the vaccine slide that shows the number of people that are vaccinated. There we go. So
this is significant that 92% of our total population, which does not include our ineligible 5 and under residents, 92% of people have had at least 1 COVID-19 vaccine dose, which is significantly up from even just a month ago. 70% of our total population has received 2 doses of a COVID-19 vaccine, Moderna or Pfizer, or one of Johnson & Johnson. We don't have the up-to-date data, but this is a highly vaccinated county.
Thank you. And I just want to acknowledge one other thing. I want to thank all the businesses that responded to those 5 questions that we did on 2 sessions ago, and then I submitted last week. We had hundreds of responses, and I probably should have set up a form because you each sent me a separate email. But I want to acknowledge that all of those were put into a spreadsheet that was then submitted to Boulder County Public Health, and they acknowledged on the Board of Health meeting receiving over 350 responses. There were a lot. So everything was read, everything was taken into consideration, and I appreciate everybody that did submit feedback, because it did make its way to the decision makers. Yes. We have no more questions, but one more thing. Someone just wants to express deep gratitude for sharing information, collecting feedback, and guiding businesses through this confusing and chaotic time. And I want to say that I feel very fortunate that you guys have trusted me. Everybody's trusted me to continue to provide some of this information and be able to guide you through this. And I appreciate Boulder County Public Health stepping up and being on these calls, because they haven't always been easy. You've been challenged. Some of the questions you've been asked haven't always been the easiest, but you've come every week and you've been here and you've answered the questions to the best of your ability and just tried to stay as good and open with the businesses as possible. And you had a business liaison team, and some other counties didn't have that, that was there to help businesses particularly.
Yeah, and I'd like to just say, Corinne, I mean, I feel like you are like de facto public health person. I feel like you know more about COVID than I don't even, I mean, you are well versed in this. And so
someone on the call actually a couple weeks ago called me the COVID whisperer, and I'm not sure I want to keep that nickname for life. It's better than the COVID spreader, but COVID whisperer is not there. So I appreciate everybody joining us today. We're probably not going to have a session next week. We're going to look at these as needed, but I will continue sending out updates and emails unless we need some sort of session. We'll send out, you get data every week. Maybe when I'm sending out these emails, I'll send out the data so people can look at them themselves. In the meantime, Tessa, have a wonderful weekend. As of 5 o'clock today, you're going to see all over town, masks are no longer required in any facility or in education unless it's part of that state and federal, state and federal orders. Reminder that your kids need to wear a mask on the school bus on the way to school, even if they take their mask off at school. So, masks are still going to be around. So if you need them, just let us know. Let me know, because I still have some for Boulder and we still have some for Louisville and Superior. All right, everybody, have a wonderful weekend.
Thank you.
We'll see your smiling face around town.